Good morning, everyone, and welcome to our conversations with leaders about NORC, naturally occurring retirement communities. I'm going to begin with the land acknowledgement and then say a little bit about Compassionate Ottawa. Compassionate Ottawa acknowledges that we are located on the unceded and unsurrendered territory of the Anishinaabe Algonquin Nation. We work here to pay our respects to Indigenous elders, past, present, and emerging. I also want to acknowledge that this Conversations with Leaders is proudly sponsored by Zapure Wealth Management of RBC Dominion Securities. We're very appreciative of the support offered to us. So let me tell you just a little bit about Compassionate Ottawa. We're a community organization that encourages people to care for each other, especially when facing serious illness, grief and loss, or as caregivers. We do this through workshops and conversations, webinars like this one, special projects, and special research. And we do this collaboratively. We work with others to change the attitudes about death and dying, to encourage building networks of care, and to tackle loneliness and isolation. All our work intends to build the capacity of individuals and families and the whole community so that everyone can live as well as they can for as long as they can. So I'm delighted to introduce today's Compassionate Ottawa volunteer who will moderate the conversation with our guests, and she will introduce our guests. I want you to meet Mary Lou Kelley. Mary Lou leads our work reaching communities that have often been left out of the discussions about living well, and who brings us ways of thinking about the end of life that reflect various traditions and cultures. Mary Lou is Professor Emeritus of Social Work at Lakehead University, bringing a long and distinguished history of research and experience in the field of palliative care, including with Indigenous Canadians. Welcome, Mary Lou, and I'm going to turn this over to you now.
Good. Thank you very, very much, Monica. And it is such a privilege to be here having this conversation today with Sue and Vince. And I've got a personal interest because I live in what I now know is called a naturally occurring retirement community. And I know and many others, we have 192 people that registered for this. We all want to learn from your experiences. So it's just terrific that you can join us today. Thank you. So I'll introduce each of you. I'll begin with Sue. Sue Garvey is a social worker and a community leader in Ottawa and a passionate advocate for social issues such as women's issues, homelessness, and affordable housing. Now retired from full-time employment, she continues her advocacy efforts as a municipal policy advisor and by providing leadership in implementing Ottawa's first Oasis program, which is an example of programming in a NORC. So welcome, Sue, and it's been just a delight. So Vince DePaul is a physiotherapist and an associate professor at Queen's University in Kingston. He co-leads the Oasis Project, which aims to develop, implement, and evaluate Oasis programs, and works in collaboration with seniors who are living in naturally occurring retirement communities, also known as NORCs. So thank you. You've got valuable expertise to bring to the table from a national perspective, not only Ottawa. So again, thank you both very much for being with us. I think we'll begin today by each of you elaborating a little bit on your role in the NORC program. And I'll start with you, Vince. If you could describe your role and help us understand a little bit better about these terms, NORC program, Oasis, like what's it all about?
Sure, thanks. Great questions, and really great to be here with you, Mary Lou and Sue, and thanks to Compassionate Communities in Ottawa for hosting. So I was first introduced to NORCs a number of years ago. The concept of NORCs through, I'm a physiotherapist, and in my work I work with older adults in various capacities. But I was first aware of NORCs through the Oasis program that is in Kingston. And we partnered with this Oasis program, my colleague Catherine Donnelly and I, in 2017, and started to understand the program, but also understand this phenomenon of these naturally occurring retirement communities. A naturally occurring retirement community is, as it sounds, just a geography. It could be a neighborhood or an apartment building that happens to have a higher proportion of older adults than the general population, say. But it's not built or structured specifically for older adults. So that's that naturally occurring. Many times it's in a neighborhood, it may be a community that was once full of children and families, and then people just aged in place and it became a naturally occurring retirement community. In apartments or condo buildings, it can be the same. People move in with families and they age there. Other times they've transitioned from home to this location because they might have good amenities, close to resources, or often they know somebody in the building and they go there, and it becomes this space where there's higher number of older adults. A NORC program is so on its own, that's just the NORC is just a NORC, and again, there can be positive NORCs and there can be the neutral, nothing organized around the NORC. The NORC program is intentional programming that supports the older adults in the community to age well. So that and the Oasis program is one example of a NORC program. So specifically, the Oasis program is older adult driven. So older adults direct and plan what they want in the community, and they have the support of an on-site coordinator, somebody who's there part-time, who doesn't live in the building but is there as to help facilitate enacting what they want and implementing. And a lot of that is done by connecting with existing services in the community and bringing those services or programming to the apartment, the condo, the neighborhood space that's involved. But it's not the only model, but that's one specific model, and we feel that little bit of assistance to support people to build this community as they wish to, we find helpful, particularly for some communities. Other communities can be more, they might have a social committee or another and do this on their own, but this is the one unique element of the Oasis program.
So from sort of a research perspective, like what is the real value added for seniors of living in an environment where these kind of supports exist?
Yeah, it's so we've found, and there is other research that support this, that having this a little bit more structure and the support of something like the Oasis on-site coordinator helps sustain activities that people want. It helps build the social connections between people by having that little bit more structure. Within the Oasis program, there's three main pillars. So building social activities and social connections, promoting physical activity and physical health, and then nutrition-based activities and coming together around food. On top of all of that, there's also knowledge sharing and between members, residents, but also, again, bringing bringing experts from the community to share information, whether it's health information, information about resources. So the added value is this building community, but also access to information and this programming that they may not have.
Thanks. So I'll turn to you now, Sue. You're living in an Oasis project. You come to us with lived experience. Can you tell us a little bit about your role and give us an overview of the Oasis project that you live in?
Good morning. I'm really happy to be here as well this morning. I've been kind of following the development of Compassionate Ottawa over the last couple of years and thinking as we've been developing Oasis here that, we really do have a lot of complementary and I think well-aligned visions and activities going on. So it's good. It's really good to be here with you this morning and to talk about my little part of the world, which is the Ambleside Oasis, kind of the first officially funded and organized Oasis program in Ottawa. So Ambleside is really a combination of 3 different condo buildings in the west end of the city. We have about 800 units, which means in the total of the 3 buildings, there would be that many people. And then in those 3 buildings, depending on which one you're talking about, we would have anywhere from about 45% to about 60% of the people living in each of those who are people over the age of 65. And as Vince said, it's just a naturally occurring retirement community. So no one came here thinking they were coming to be in a NORC. I didn't know till a couple of years ago that I lived in a NORC. But, we've all been learning together as we've moved along. We also have the wonderful privilege of being situated in Bay Ward, which here in Ottawa is in the west end of the city and is the ward which has the highest proportion of older adults in our city, and indeed very close to being the top in the country as well. So we are very much a community that is ripe for a NORC and an Oasis project to happen.
So Vince made reference to the pillars, social, physical well-being, nutrition. Can you describe what's going on at Ambleside?
Sure. So it's really nice that we have the 3 buildings and we're all working together. So imagine people who before were kind of more centered on their own building are now kind of moving back and forth between 3 buildings quite freely in a way that hadn't been doing before. So really the programs are, in a nutshell, whatever people want. So we've been experimenting over the last couple of years around, what draws people, what people feel that they need and want. So it's shared meals, lots of social activity happening together, walking clubs and book clubs and all kinds of, gathering for social purpose together. We have exercise programs going on in all 3 of our buildings that people are attending. Lots of educational seminars around topics of interest to people. So, fraud prevention, fall prevention, long-term planning, all those kinds of things. So, really depends on what people are interested in and asking for. We meet on a monthly basis as a community to do that planning together with the coordinator. And then her job is really to try and bring in and organize some of those things that we are saying are important to us.
Wow. Thank you so much. So Vince, I'll go back to you. How are Oasis projects spreading nationally?
Yeah, no, it's so the original Oasis, as I mentioned, started in Kingston, and that was officially 2011, but so it's been operating since then. We, Dr. Catherine Donnelly and I from Queens partnered with the original Oasis to apply for funding to spread to evaluate it, but also see if we could spread it and scale it to other communities. So we're at now 18 communities across the country, including British Columbia, Ontario, and Nova Scotia. And all of those, we've had about 3 waves of spread, including just finishing up a third wave. And that is all through a variety of funding sources. So through a federal grant most recently, a provincial grants, as well as philanthropic donors, to a donor who is identified this as something they want to support and they think is really important. So what happens, a community can, in the 18 that we've been working with, it happens in a number of ways. Often it's the community themselves, including an older adult or a group of older adults who reach out and say, this is something we're interested in, and then we connect with them, and then we build this relationship with them to identify the other supports within their community. So there's 3 key elements you sort of need to get going, including the interested residents, of course, and the committed residents, but also a landlord or property owner, in the case of, and that could be the condo owners themselves, saying we're willing to have these programs in the common spaces, so there has to be some space to meet. And then the community partners, so the agencies, often there's one lead agency in the community. So in Ottawa, it's Old Forge, who brings, where that on-site coordinator sits in terms of an employee of them, but also there's many other agencies and resources. So the community health center in the Ottawa, Sue may speak to, bringing in all these supports that from around the community to come in and do the programming. So that's the model that's happened across the country. One thing about the Oasis spread is that when people have an Oasis program, they become part of an Oasis network. So the coordinators meet on a monthly basis. Members can communicate with each other across the country. So they have the support of the Oasis project staff to help develop and sustain your community.
Thanks. I have one more question before I go to Sue. Not everybody that lives in a NORC are seniors.
That's right.
So can you describe the involvement or role of non-seniors in the Oasis program?
Yeah, so absolutely. That's often one of the attractive parts and the added value, that it's a mixed age community. So non-seniors may be involved as volunteers in some of the communities, advocates. There is no strict cutoff for age in the communities. It's certainly the programming often is because it's seniors oriented, meets the needs of seniors, including the time of day they're offered, but you see different levels of involvement of people, of younger people. You can get young youth and involved as volunteers from the neighboring neighborhood, the schools, or people who live in the building. So it's been and often those are the most rewarding things to see those kind of activities happening. So including young children. So those relationships. So at one site, there's one of the grandchildren of one of the regular members comes regularly. So they have many grandparents in this community. So it's a nice sort of.
You can't have too many grandparents.
Exactly.
But what I'm hearing you say is that, I mean, there's no cookie cutter approach. It's not a one size fits all at all. that these communities really are highly, highly diverse.
Absolutely. There are some common elements, as we, say I think the common elements are those pillars, but the empowerment of seniors to make decisions for themselves, and rather than a cookie cutter prescribed program that's dropped in. But because of that, each community is quite unique, and that's intentionally unique. So.
Great. So Sue, I'll turn it over to you now. And, based on what Vince has said, like, can you just elaborate a little bit more on what Ambleside has chosen to do in the way of, programs or activities? Tell us a little bit about your coordinator. Tell us a little bit about how non-seniors are also involved.
Sure. So I guess one of the things that we have found has really worked in our building is that people are really interested in learning type activities. And so, we have, a whole pile of different things going on, but we end up oftentimes having our biggest turnout when we have, guest speakers come in and talk about topics that are important to people. Care for the caregiver, learning about dementia, planning ahead for your future. As I said earlier, fraud prevention, falls prevention. So it's a lot of educational type things seem to gather people here. And then people come and they start to meet the community and build the community and become part of that. And then it becomes, all kinds of social things happening as well. Those shared meals are so important. So it really kind of does very organic, I would say, in terms of the way it develops, and very resident led. So if people say, let's have someone come and talk to us about hearing. We had someone come and talk to us about MAID recently. Just whatever, is interesting to people. Our coordinator works with us on that. Our coordinator is a social worker as well. Young woman who's interested in working in community like ours, a real community development kind of skill that she has, in sort of really understanding the importance of it being resident driven and empowering and working with people to have, our internal leaders step up and really take leadership.
Yeah, I think that idea of leadership is really, really important. I mean, can you elaborate a little more on how that sort of evolved or got nurtured, or because sometimes people want to participate, but it's a little bit harder to get the leader.
Yeah, I mean, I think that we've been very fortunate here in Ambleside because we do have some natural leaders who are very interested, committed, and passionate about aging in place, basically, and really see the need. And are people who were able to connect in their own buildings with people and see how they can, really benefit the lives of everybody who's here together. So that building and gathering internal leaders has been really important. And I think that one thing that's true across the board is people don't know oftentimes that they're natural leaders, unless they're asked to step up and be part of something. And then, we've just had this wonderful team of, in our core group here, we have 6 leaders, 2 representatives from each of our 3 buildings. But we have been kind of building that out and bringing more people in as we've moved along.
So I'm very interested in that. So you have 2 people who have taken leadership in each building, and are they the ones that meet monthly with the coordinator, or is the monthly meeting kind of an open meeting for all people who live in the building? I'm trying to understand the structure.
Yeah, so basically, kind of on the umbrella level, we have a steering committee, and that includes 6 resident leaders, 2 from each of the buildings, couple of people from Queen's University and Vince's team, couple of people from the Council on Aging, representative from the Old Forge, and our coordinator. So all of our key players are represented on the steering committee. And then internally, we have been meeting with our coordinator, with whoever wants to come, who, you know, all residents are welcome to come and do our monthly planning together and talk about the kinds of things that we like to do together.
Yeah, great.
Is that
So,
getting it?
yeah, oh yeah, no, that's very, very helpful. You know, I remember you saying when we were planning for today that there's a lot of inspiring stories that you have seen as a result of your Oasis program. Can you share some of those?
Sure. Well, I guess I want to say that it's become very clear to those of us who were involved in this project that aging in place is the best model for healthy aging, that people overwhelmingly want to stay in their own homes for as long as possible, and they want to age there with support. The research says about 96% of older adults want to stay in their own homes for as long as possible. So I think we're driven by that, by knowing that, and knowing that people want to be engaged and contributing and live where they have a sense of belonging, and they can both give and receive in a way that's healthy and suited to them. So I just want to go back to, tell me again what you were.
Well, I was just inviting you to share some stories or.
Oh, some of the stories, yes.
Yeah.
So, you know, I think the part that is so exciting for us is that we're just seeing it work on the ground every day. That is our experience. And so there's lots and lots of stories of people who are feeling more connected to their neighbors now. You go in the elevator, people are talking with each other more, they know each other by name. People are socializing outside of anything that we're doing together at Oasis. Just if you came here today, you would see people going off to possibly a wellness clinic that we have going on this morning, which is a partnership we've developed with the paramedics and our local community health center, really geared to people that don't have doctors, and so are able to go in and kind of have a really good health consultation. That's happening. We have a woman in our building who has been writing her life story, and people are invited to come and listen to her share as she shares her memoirs. Just a lot of different things are going on. One of the things that I think for me has been a really wonderful outgrowth of Oasis, and I really do believe would not have happened if Oasis hadn't been here, is that we've been experiencing, as you know, a lot of power outages over the last couple of years, and that's been distressing people, and probably particularly for the older adults in the building who, you know, feel very isolated if the power goes out, and they become disconnected very quickly. And so what happened in one of our power outages recently was we just went around knocking on people's doors and said, if you're by yourself and you want to come downstairs to our party room, our common space, just come down. You can charge your devices if you want to, because we have a generator in that part of the building, and we'll just hang out together. Well, it ended up being a party. So here we are, everyone's kind of in the dark in their own unit. But downstairs, you know, people were bringing food out of their freezers, and we were ordering pizza for dinner. And, you know, it just is that kind of spontaneous thing that happens because people know each other. They're starting to know each other. They're starting to feel welcomed and invited into shared spaces. And so now what grew out of that was we have a whole emergency plan in our building and the other two buildings as well for what kind of supports will we provide to people when a power outage happens. That's just one example.
Mm-hmm.
There are many, many, many.
That's a terrific example. And maybe as we progress, you'll think of some others to share, because I see super positive reactions in the chat box, you know, when you start to elaborate. The one thing I don't think you mentioned is the role of the non-seniors. What
Yes.
specifically is happening? They didn't push back at all, did they?
You know, that's a really interesting question, Mary Lou, because at the beginning, we were just kind of feeling our way along. We didn't really know much about NORCs or about Oasis, so we're kind of learning as we were going. And as we introduced the idea into our building, that was one of the questions that came up was, oh, are you trying to turn us into a retirement residence? And there was a bit of a sense of, how is this going to affect the people who aren't seniors? We made it very clear that one of the things that matters most to us is that we remain a multi-generational building, because that is part of healthy living. But it's also something that we really want. And so, as Vince said, all of our programs are wide open. Anyone is welcome to come. They are often geared around topics that might be interesting, particularly for seniors, but everyone's welcome. And people do come along, and they, for that emergency plan, for example, it ended up having people of all ages on the emergency plan team that is going to kind of see it through as we go forward in the building and be knocking on people's doors and all that sort of thing. So people just naturally, in the same way that the seniors get drawn to things they're interested in, other people in the building do the same.
Yeah. And I would imagine the younger people are not there as often, or they're working. So
yeah.
their social networks often involve workplace, and they're not available for things during the day. So it sounds like you have a good balance for.
I think it's a good balance. Yeah.
Yeah. Okay. Well, that's great. So now, Vince, we talked a little bit about starting a NORC, but is there anything else that you can tell us about getting it off the ground? There's people in the chat box saying, how would we start, or how would we get it off the ground? What are some of the typical challenges that you've seen in the research that you're doing?
Yeah. So just to reemphasize that, so you probably are in a NORC without having to start anything. So that's one thing. So it's the NORC programming and programming the activities that you can build to support the people within the NORC, or to build community. So it really, as Sue described it, the first things are starting to talk to each other. So, and it is often a smaller group in our experience with a number of communities. And there may be this existing a social committee. Something to be aware of is one of the real core elements of NORC programs, and Oasis specifically, is the inclusive aspect. So and there can be, so it's just being aware, if you have a social committee, think about who's included and who are you missing? And I would say that's one of the first parts. And how do you then, hold a meeting or an open forum just to gather what do people envision, what if there was to be a program started, an Oasis or otherwise program within their community, what do people really feel like they need? What are they missing? Is it that social connection? We don't know our neighbors. I'm afraid because I don't know people that, if something happens, I'll get into trouble, and really identify what's important. One of the things that also to acknowledge is that we talk about intergenerational activities. Even within, when we think of the official seniors, say 55 plus, if you think about, there are probably 3 generations within 55 to 105. And so with people of different experiences, different needs, different interests, and thinking again about how can we try and plan for those various communities within the community. From the Oasis perspective, I would encourage people to reach out. We'll post our email to reach out to us, although there's not active expansion right now in terms of funding. We can partner and share resources to try and think about, we have a ready, set, go manual that we can share in terms of the steps that you can do in your own community to move yourself along, depending on where you're at in that pathway. I think the other part is communicate with your landlord. Our experience with landlords or property owners is they are very, very positive about this type of activity. People talk about just, your example, Sue, about the emergency preparedness. That is actually that happened in another community, and there's peace of mind in actually having tenants or residents who are prepared and are connected. It means they're not always, say, going to one individual, the super or a property manager, and the property manager then has these answers, and they can benefit from this social network web that's been created and buddy system or whatever the case is. So speak with the property owner and build that relationship, and then reach out to the community resources that exist. So Sue mentioned the Council on Aging. Council on Aging is such a good resource, and in Ottawa in particular, they've mapped the NORCs, or they're using NORC maps to identify where people are and where people can benefit from these types of programs. They're just finishing, I believe, a process where they're identifying those key elements, including space within each of these environments across the city. So I must also say, the Ottawa itself, the city of Ottawa, is a really excellent partner. Now, not all of these people are going to be able to provide funding, say, to hire a coordinator, but they can help connect you to other resources in the community that will help you build these programs within your own space. But just from the Oasis team, we'd be happy to talk to people and think about how we can help you in your communities.
Yeah, so I just want to pick up on one of your comments. I mean, although it is very beneficial to have some funding and a coordinator, is it still possible for NORCs to organize internally and do many of the things you're describing without any paid involvement?
Yes, so they exist, and you see these particular communities with some of that leadership that Sue's talking about, people with those experiences, and that's most communities. So it absolutely is possible to get some of these programs off the ground without a paid external person. We've found in our research that there are added value of having that person, and we would advocate for, but not every community needs that level of support. And there's models. There's a model that's out of the NORC Institute in Toronto that's called the NORC Ambassador, where they support. They have some learning materials that will support, some of the leaders within a community to say, what kind of activities that can they initiate, how to organize meetings, those types of things. And that's another level that's sort of lighter, more internally, and using the internal resources rather than relying on this additional help of an Oasis coordinator. We do find, though, that there are some sometimes, and you may, in your own buildings, you may hear, that say, I started a social committee, or I started an exercise program, and I ran it for 3 years, but then I got tired, or I or that person moved, or whatever the case is. So the sustaining can sometimes be more difficult if you don't have the external supports, but it certainly is completely possible to get things started and get things moving. We'll talk about advocacy, but I would advocate that some environments and we should be advocating for support from the provinces that we live in, this is a low cost model to support people to age in place, and with I think many benefits that we're starting to see in terms of the health and well-being that are worth the low cost it costs to do this kind of a program. So
I see you nodding, Sue. I think you agree with that.
I do.
Yeah, and we'll talk in a few minutes about your advocacy at the municipal level and that sort of thing. I want to pick up on one of Vince's comments about the importance of getting the condo board involved. And one of my observations of living in a condo is the board is very liability cautious, and I wondered about your experience with your own condo board and whether any kind of, not that they wouldn't be in favor of the concept of what you wanted to do, but were there concerns about running some of the programs or liability around that sort of thing?
There were those concerns in the early days for sure, and I think probably that was some of the early work that really took some intentional time. It was good to have Vince and his team there because, of course, we were not the first Oasis, and they had been through this process a number of times. I guess we were unique in that not only do we have a condo board, but we have 3 condo boards. So we were trying to kind of develop agreements with our condo boards that would be pretty similar among the 3, given that we have 3 completely different governance structures, and we were trying to bring all that together. So a lot of work on that for sure. And as you've said, Mary Lou, there will be those concerns about liability, and the place where we really intersect with the condo boards and with their interests is that use of the shared space, right? Because that, we need to have some communal space for Oasis projects to operate out of. And that was where we often had to have the conversation is, how does that work? Do we get free access to shared spaces? What are the liability issues? We're fortunate that liability is covered through our contractual agreements that we have with Queen's University and the Old Forge, which is our community partner working on the project with us. So, all those things do get covered off and addressed, but there certainly was work up front to kind of talk through all those pieces and how are we going to make those work. And then getting our condo boards kind of past the original, those issues of liability and all that, to see this is something that's really important to the people in our building. As Vince said, in the end, we're all going to be better, including the property manager and the condo board are quite happy when people are doing well in their buildings. There's less transition, less, crisis happening because people are well supported. So now we're at the place where that's kind of it's just a given that we work together and we're complementary, and there's a lot of support there. But we had to work through some things in the beginning for sure.
Yeah, I'll just add one of the I would say the complexities is that what happens and it's really the Ambleside Oasis is a perfect example. You're building community, so there's things that are happening. People will decide to get together, and this happens at elsewhere. Get together in the evening for cards, and that may have been happening, but in some places people hadn't been meeting. So there's Oasis activities that happen when, say, the coordinator happens to be there. There's Oasis activities that happen all other times of the day in terms of, and they're not necessarily coordinated just because you've connected people together. They're doing activities together and they're meeting, and so it's this broad sort of experience of the types of things that can happen either strictly as part of a NORC program and the spill out effects. And then to say, so it's clear when there's a particular, say, an exercise program happening at this time to this time, you know, then there's the having insurance through Old Forge is really helpful. And but then there's these other elements that people are gathering together, even going out together, and that, so that are more natural social connections that.
Sure. Yeah, Sue, you mentioned, and then Vince did again, Old Forge. Now, somebody who hasn't lived in Ottawa for a really long time, can you talk a little bit about Old Forge and who they are, what they do, and how they have become such a key partner?
Sure. So the Old Forge is a community resort center in the west end of Ottawa, who is particularly focused on providing services for seniors. So they've been doing programs for seniors, community-based programs for many, many years. So as we set up our structure, we need to have a community agency who is sort of a contractual partner that works with Queens on funding and all of that, but also has experience in providing programs like some of the ones that we have here. So the Old Forge was a perfect partner for us. You know, from the very beginning was keen on being part of this project, could see that it was just complementary to what they were already doing. And so they became the community partner, which with the agency partner that works with us on the steering committee and also in delivering the programs.
And I see Colleen Taylor putting a note in the chat. So yeah, Colleen and her team are just so, we're just really fortunate from Queen's perspective to have them as partners in this. But I think as Sue, you say, and it was intentional in reaching out to Colleen
Absolutely.
in this activity. So yeah, thanks to Colleen and Laura, the coordinator.
So Sue, what do you think, you know, is kind of, if anything, kind of the future goals in Ambleside? Any sort of next steps if you're thinking about the evolution of your Oasis? And what happens when the project is over? You know, like this is kind of, I assume under Vince, this isn't open-ended, you know, your role and contribution to that won't last forever.
Yeah, so there are so, you know, with this, the coordinator at Ambleside is being funded, you know, they're an employee of Old Forge, and this is being funded by a time-limited grant that we are seeking to renew and continue to seek funding with our partners at Ambleside and Old Forge and likewise. So we're in this for the long term, as long as we can find sources of funding, and we've there's been 6 Oasis sites that have been operating since 2018, and that's how, you know, it's this sort of funding to funding, which is not unusual for social service type programs. So we're certainly, the plan is for this a long-term relationship, but our role transitions certainly from, you know, sort of more supportive at the beginning, but you know, Sue and her partners within Ambleside are quite apt and independent in moving forward and sustain that, but our relationship will continue, certainly.
Well, that's a great segue back to you, Sue, and I guess I started out asking you about the future, you know, and kind of the next step. And I know you wanted also to, you know, to speak about the advocacy work you've been doing. So maybe this is a good time for that.
Yeah, so kind of two questions here. I think Mary Lou and I would like to talk about both of them for a few minutes. The first thing was, I think you were kind of talking about our vision, like what's our vision for where we're going and what do we see happening as we continue to develop and grow. And then the other one is just around that whole advocacy and sustainability piece that we also are doing some work on. So maybe I'll just kind of chunk those two off. In terms of vision, I would say it's funny because we've started to call ourselves the Ambleside movement, because it's just been incredible to us how the energy and momentum that has happened in the last couple of years since we just started talking with each other. So, you know, in terms of our vision, I think the sky's the limit, really, because we have found that when we reach out to other partners in the community, to other groups of people like ourselves, people just want to be involved with us. It's an idea whose time has come, and we're seeing the need and we're seeing the interest all across the board, from government to community groups to just people like ourselves. So the sky's the limit in terms of what we can do, really based on our own interests and the energy that we're prepared to put into it, because we're finding a lot of resonance out there from people that we approach and say, would you want to come and be part of this with us? I think we see some things on our radar that are particularly important to us as kind of next steps. And it really has been our experience that we've gone from step to step. You know, the first thing happens and then it leads to something else, and we meet someone else, and, you know, it keeps growing. But we are wanting to be sure that we continue to reach deeper into our own community, to those people who are not coming out, who are not engaging so easily. We know that there's still a lot of seniors who are quite isolated and are not kind of natural joiners like some of us are. We want to make sure that those people are not forgotten and left behind. And so there's energy that we're needing to put into thinking that through, how we do that. Communication is a big thing because a lot of our seniors are not using the internet or email. So, you know, finding ways to communicate with people. And the other big thing that's on our radar really is the whole realm of healthcare, because our healthcare system is so broken and struggling to meet the basic needs of people. We're finding that we're doing things that are sort of helping people to manage as we go through looking for the right health supports for people. So a lot of health education. We have local pharmacists coming in. We're working with our local pharmacists on some of the things they can provide right in the community to us. As I said, lots of educational sessions. We have this big wellness clinic that's happening today, where we've brought together some paramedics with our local community health center. So the whole area of health, and what are some of the things that we can do at the community level that can help people to manage within the healthcare system as it is now, and also helping us to press on how do we change that going forward. So that sort of brings me to the second piece, which is around sustainability and advocacy. And we have seen that as being a really big part of our responsibility as well. We do believe that every single community needs to have an Oasis type project so that seniors are able to age at home with the supports they need. And we know that that's good for seniors, it's good for communities, and it's actually good for funders and government as well, because it's a lot cheaper. So, you know, we have made an effort to be speaking to our local elected people at all levels of government, because the solution requires everybody to be in the mix. And we've become quite good friends with all of our elected people because of that. I can tell you from the municipal level that because I work in the office of the city councillor, that we're working locally with the Council on Aging and the whole senior sector in Ottawa to be developing our older adult plan for the city that's inclusive and aware of the needs and wants of seniors to be aging in place. We're working on an anti-ageism policy at the city level, and all kinds of things are going on there. But as we all know, a lot of the responsibility for health and for seniors is at the provincial level and some at the federal level. So we do see that we need to keep doing that advocacy. We can't continue to have small, short-term funded programs that are, we're fortunate that we have a donor that has stepped up to help us get going. But these are core services that need to be in our communities, available to all seniors as they age, because it's prevention. It's helping people to stay out of those expensive long-term care hospitals that is where a lot of seniors are ending up just because we don't have community supports. So that's what we're advocating for and working towards, and really see as part of our responsibility to help other groups like ourselves get going.
That's terrific. Vince, we're going to wrap up in a few minutes and turn it over to questions. But there are some indication that we've talked mostly about condos and apartments.
Mhm.
Do you have any comments about neighborhoods, and what is your experience about people who are still living in their own private home, but they are, as you said earlier, in a neighborhood where the demographic is very much seniors?
Yeah, no, absolutely. So we have two, actually three examples within the 18 of what we call a horizontal NORC. So rather than a vertical being a condo or an apartment, but a horizontal like a neighborhood. There's a really nice and exciting initiative in Toronto where it's a group of within a specific neighborhood, group of people coming together to try and find ways to support the older adults who live in their own homes within that neighborhood. And so the Oasis in that neighborhood is run out of a school that's no longer a school. So that there's a portion of Old High School that there's a shared space in that they have a drop-in, just like you would dropping into your common area in your NORC. It's in your apartment building, it's in the school. And they've had all the types of programming that we're hearing with the specific communication needs of how do you distribute to the neighborhood and build connections, and that's going really well. So the other examples are a housing area that's a co-op. So people are connected through the co-op, but it's a more distributed and a horizontal where people are living in their own houses. And there's another mobile home community the same. So there's a common space that people come to, but they're living independently or living separate in a house or a trailer or something like that. And they've worked really well. So it's not specific, but just as every apartment or condo based Oasis is unique, these have these unique elements as well. So it's definitely possible to do.
Great. So Sue, I promised you the last word. So what would be your advice to the people on the line that are now all revved up and excited about taking their NORC and creating a program, be it Oasis or some other form of cooperative activity that will support everybody? Should they do it?
They should do it. They should do it. And I guess, I think we've talked a little bit as we've gone along, but I really do think just start, don't wait for funding. Just get going, start talking to your neighbors, reach out to your local elected people, reach out to your council on aging type organizations and organize your seniors community resource centers like the Old Forge. Queens has been such an amazing partner because they have this long history of, studying aging in place and knowing that it works, but also bringing people together and networking. So I think that there are some wonderful resources out there. We've talked about some of them today, and we'll be providing more to people after this. But just get going, get talking to your neighbors, and it really is quite amazing what will happen when people come together and start talking and reaching out to the resources that they do know about. Because one thing will lead to the next, and the next thing we're 2 years down the road and we can't believe what's happening. So it's and it's possible, across the board, and it needs to happen across the board. So yeah, I just say go for it.
Good. Well, on that note, I'm going to turn it over to Paula. And Paula's been monitoring the chat, and she's going to share some of the questions in the chat.
Great. Thank you so much for this conversation. It's been truly enlightening for, I think I can say, for everyone watching. We have received a lot of questions. I think many of them have been answered in the course of your discussion, but just to the audience, if you have a question that has not been answered, please submit it now in the Q&A box. We're going to get through as many as we can in the time that we have remaining. So the first question that we have here is, how does a group trying to set up programs in an unorganized NORC get help from the Oasis program?
Yeah, so I think the first step is to reach out to us. So we have an email that's oasis.study@queensu.ca. We will share this afterwards, but so you can reach out to us. That's the first step. As I say, our support at this time will be, we will share information about the steps in addition to what we've talked about today, and ideas. And we can, depending on your situation, sort of collaborate to think about, where potential funding can come from if funding is needed in your situation. So yes, that's the first step, is to reach out, and then we can go from there in terms of depending on your particular context. And I think I also, not to promise you your time, Sue, but I think we bring not only our expertise, but we have the expertise and the experience of the communities like Sue and her group, and otherwise across the country. So we're at different stages of the development so that we can connect people. So.
Great, thank you very much, Vince. And to clarify for everyone watching, you will receive an email with a couple of resources from today's discussion, and that will include the email address that Vince just mentioned for reaching out to Oasis. The next question we have is, how does a NORC become officially designated?
Well, I think that's for you as well, Vince.
Okay, sure. So it's so as I said, you don't need a special designation to be a NORC. You might just notice in your building that there's a certain demographic, and that probably means that you're a naturally occurring retirement community. If you go to the Ottawa, if you live in Ottawa, there's the Ottawa Council on Aging. They have a NORC finder, which you can actually see, and you can find, if you're in an apartment building, you can see that. I don't think it includes neighborhoods. We've done some mapping of neighborhoods, and actually across Ontario and now in British Columbia, where you can see where people live, and we have interactive maps that actually we can also share. But it's as I say, it's only so helpful. It might just confirm what you're feeling, that you are a NORC. Now, if you want to be have a NORC program, that does take these steps of planning and working together. That's just the steps you need to take.
Yeah. I was going to say, so the NORC itself, it's just a place.
It really is,
and the NORC program, of which Oasis is one specific, one specific specialized program, but not every program needs to be Oasis.
Right.
We don't have to get your permission to start organizing in our building.
No, absolutely not.
And we wouldn't be an Oasis program. We would just be a NORC, a naturally occurring retirement community, trying to organize amongst ourselves to do the kind of things that you're talking about. Yeah.
Exactly. Yeah. And I do want to give acknowledgements to the work that the NORC Institute are doing in Toronto. So they work in this space and really trying to support people as well. So they have nice resources on their website, including a map of Toronto that will tell you what, where the buildings are and things like that if you're in. So,
and just I've looked at a few documents in a sense for an official definition. Some say 30% of seniors or more, some say 50. What does your team, what criteria do you use?
Yeah. So when we were identifying, so looking at potential sites, that we were using the 30%, and we're quite open about that, depending on, because it could be, again, it's if people see a need and and 30% of 600 units is different than, is still a high number of people without benefit from this type of so there's a number of sort of criteria or factors we considered in that. When we were, that was one process, in terms of we were looking at maps and identifying buildings within. The other process is people reach out to us. So that's the actual situation of Ambleside. People were reaching out, and then we went through a process of sort of readiness and looking at and facilitating that. So.
Okay.
And then you've mentioned NORCs connecting with community organizations for support and funding, but can you explain the funding process and how that comes about a little bit more concretely?
So in our particular situation for Oasis, we've applied to specific funding calls. So the latest that we've just finished up in terms of expanding to 6 more sites is through the Employment and Social Development Ministry in the federal government, and they have Aging While at Home program. So there was a call for scaling up sort of promising practices to support people to age in place. So that was so we applied for that funding in partnership with our other partners. So I have to give shout outs to, we have partners at Western University, as well as McMaster University, and our core partner is the Oasis, the original Oasis board, which is chaired by, it's a volunteer board, but Helen Cooper, who's been so helpful in giving us history and also this grounding us in the original Oasis model. So the funding is, we apply. So again, the other funding that Ambleside is funded through is an anonymous donor who has been very, very helpful and keen and continues to, and we're in relationship with them, and they're interested in expanding this model, and so that continues. If at the moment, so there may be future opportunities for funding, and that's where it's always seeking out. So what happens is Queen's lead with partners applies, we may have these funds, and then we look for these communities that have that we can partner with, and then the funding flows to the to a community agency or such to sort of help with that cost of the coordinator. That's really the one cost of Oasis. There's not really, everything else is sort of in-kind contributions of the landlord or the property owner, the people power of the members and the residents. And so that's the one cost. That's how the funding works. So.
And then in a similar vein, Sue, you mentioned contractual obligations to partners. Can you clarify what that means a little bit?
Yeah, so, there's a couple of, as we got going, we needed to organize ourselves in a couple of different areas. I would say there's sort of the contracts and agreements we needed to have with our condo boards in terms of use of space and all that sort of thing. And then we have contracts between the Old Forge and Queen's University as the community agency who is responsible for employing our coordinator, for liability, all of that sort of thing, program costs, in relationship with Queen's University, who is kind of the main, the sort of the point for all the funders that we have in place at this point. So those are sort of the two main areas of contract. Vince, am I missing anything?
No, I think that covers it, but there's they're just, and we call them memorandums of understanding, and it's really, yeah, it's just identifying responsibilities, and it's required, but it just, there's a lot that happens in good faith, and this is just writing those things down. That's an important piece of it. I think you mentioned the if it wasn't a condo and it was an apartment, then the landlord, there'd be an agreement between the Old Forge or the community agency to be able to basically, that it's okay to use the space and come and go into the space, so that agreement that's there too. So.
And then are there many NORCs that have critical agencies part of their communities within, for example, a PSW agency right in the condo or a transportation hub?
Can you repeat the beginning of your question? Sorry.
Sure. Are there many NORCs that have critical agencies as part of their communities within, for example, a PSW agency right in the condo or a transportation hub?
So there are not many NORCs like that I know of. There are particularly that sort of begins to look like something different, more of an assisted living environment, particularly when we think about PSW or other health oriented supports within an apartment. There are really good models of that. I wouldn't say that fits the NORC model. We've had conversations about, and there's been some examples of, say, community home and community care services, knowing that there's this population of older adults within a NORC, and there's activities like are happening within the Oasis, they may, we've had conversations with them, they may have their staff coordinate their services so that there'd be one person assigned to a building, one case manager assigned to a building, so that it's more efficient and there's more continuity. So that's above and beyond what the Oasis program is, but it enables it to happen, and that has happened in some communities. They're not necessarily embedded in like having a PSW on site all the time. That's not part of my experience. There's American models like that, and there's actually some things happening in Canada where there's a space that's dedicated within a building that health services may be housed in, or they're using that space that people can come to. There's a group in Burlington that's trying this out. So that's more of a health care oriented model, and that you see some of that in the American models as well. So that's potential, you know, having a nurse practitioner on site. I find them rare, and it's just a different sort of approach to that than what we're talking here, I think. But so do you have any other comments related to that?
Well, I'm just thinking that those are some of the things that, you know, certainly come into discussion as you're just because we already have people gathering, we already have people talking about what their needs are, and of course healthcare is always part of the picture. So I think that what we've had a lot of discussion about how we kind of have a really strong core Oasis program going on. But just because that's happening, it allows some of these other things to be contemplated for people to work at putting together. So oftentimes, I think what will end up happening is we might have our NORC Oasis project and the people kind of heading that up, working to develop some other kind of well-aligned activities that are going on in the same buildings and at the same time, because it's sort of a natural growth and development, I think, of what we're doing. And that's been some of the conversation we've been having with Queens recently too, is, you know, how do we all work together at that so that we continue to build and evolve the model?
Absolutely. And it's yeah, I shouldn't it is separate, but it's complementary, and
Yeah.
and I think the work of the Ottawa group is a really nice example of that, bringing in this wellness clinic where people and they're an independent group, but they appreciate the opportunity because it connects them to people in need by providing this space to do that.
I was going to say, in listening to you talk, having the organized program, Oasis program, provides the foundation really for, you know, if you want to go up, because you know the needs of your population, and you can in a certain way organize if you want to go to a health service provider and say, I don't know, we have 30 people in our building who want foot care. Or
yes,
we have, you know, 40 people getting PSW services from 40 different agencies. And why are they spending half their time traveling? Why can't we just, you know, use this? So it makes it possible, you know, by having that program organization.
Absolutely. And I think the work that the Ottawa Ambleside group are doing is exactly sort of leveraging that. And we've seen this in some of the other communities. And it's a natural extension of the kind of work that's needed, and it provides that. So and that kind of work, you know, it ranges from, and in Ottawa, Ambleside did a really excellent vaccine distribution, and we've had that in the other Oasis sites as well, bringing public health, and they're so appreciative because it's accessing this group that's really that is hard to, has difficulties, there's barriers for them to getting these services. So we weren't the ones to deliver this product, and they weren't, or the service, but it facilitated that. So that's the kind of, I think, the natural relationship that will continue.
Great. So we have time for just a couple more questions. The next one asks, since men socialize differently than women, and this question poser says that they know there's a men's shed at Ambleside, how widely do NORCs know about or encourage men's sheds in these communities?
It's been on my mind, Sue. So yeah, there's an excellent, so men's sheds, for people's awareness, it is a phenomenon that's happened in an organized phenomenon that started in Australia, and it's come to Canada and come to Ambleside through the work of some excellent leadership of some of the people involved in Oasis. Hello to Jan. So These are there's 2 other Oasis sites that are have or exploring men's shed. And speaking, and we're connected. I sit on the National Men's Shed research group, and it's that there's I think there's lots of potential. NORCs in general, because it's true, Oasis is non-gender specific, and you could argue sheds are non-gender specific too. And I think it's one more opportunity to bring people together and support people to connect with each other, but also age well in place.
And then the final question that we have for today is there any potential for or examples of organizations like Boy Scouts, Girl Guides, and Cadets to co-create activities that can be intergenerational?
I think it's a great idea.
Yeah, I think there's lots of opportunity there. We've had the one sort of foray, excuse me, it just so happens that our fire people are in checking our fire alarms right now.
How convenient.
But yes, we have had some discussion with a local organization which provides care for children, for young people, and we've been kind of talking with them about having some of the seniors here in the building volunteer with that organization. So that connection is starting to be made, and I think there are lots of other possibilities like that.
Yeah, that's a great suggestion, and I think there's lots of opportunities. Volunteerism is a core element of, and in some of the communities, it's not. We think of, certainly there's volunteers to support programs like the Oasis program, but there's also bring people together to volunteer externally and contribute to the community, whether beyond the walls. So, and we've seen that as well. So yeah, connecting with other groups like that, I think that's perfect.
Well, Sue, Vince, and Mary Lou, thank you so much for taking this time to answer these questions. And thank you to everyone watching for submitting your questions. I'd like to take this opportunity to invite Monica Patton back up on the screen to give us some closing remarks.
Well, this has been just such an incredibly rich conversation. Vince, your deep knowledge, your research, your ability to talk to us about this in plain language has been just so incredibly helpful. Sue, your inspirational leadership in your own NORC, and I have to say across the city of Ottawa, continues just to wow me every time I have a chance to listen with you. Mary Lou, thank you. You got this conversation to cover all the aspects that we really wanted it to cover. Now, I know that we didn't get to all the questions and all the ideas, so I just want to repeat what Paula has already said, that you will be hearing from us, I think probably tomorrow or the day after. We will be inviting some feedback from you, but we will also be making available to you some resources, email addresses, and some other resources. And then in short order, not tomorrow, but in short order, this whole session, which was recorded, will be posted on our YouTube channel, and you'll have a chance to go and visit it again, listen to it again, share it with others. So you can continue to learn, and you can continue to about today's session, and about have your questions answered. And again, thank you, all of you, Mary Lou, Vince, and Sue, for a very inspiring morning, and to all of you who asked questions and who joined us. Let me just remind you that Compassionate Ottawa is a registered charity. We live on the generosity of the people of Ottawa, and we invite you to consider making a contribution. You can go to our website. We'll be sending out the information about our website, or you can go to Canada Helps. We would really appreciate your support for our work. And I just want to close by saying that it was so clear to me throughout the morning that the work that we're doing at Compassionate Ottawa and the work that is happening in NORCs, we're doing the same thing. We're encouraging people of all ages to live well.
Yeah.
So thank you. And I really look forward to the future collaboration that we can enjoy together through the Ottawa NORC and Oasis and through Compassionate Ottawa. So stay tuned for more, all of you. And again, thank you so very much. Bye for now. See you another
Thank
time.
you.